Hi everybody, this is Christine. I'm going to demonstrate the skill of IV push medication administration. So first things first, I have new orders from my doctor, and I need to verify and make sure that it makes sense to my patient. So whatever the patient condition is, his history and stuff like that, the new orders that I receive, do they make sense for why I would give to this patient? Before I give any medications, I'm going to do my 5+5 rights of a medication administration. So I'm going to verify that I have the right patient, that I have the right drug, the right dose, the right route, the right time. I think I said everything there. As well as I'm going to make sure that I do evaluation of the medication afterwards. I'm going to do the appropriate assessment of my patient beforehand. I'm going to educate my patient to the medication as far as what kind of effects they may be able to, expect from it, what kind of result we are going to go after with giving the medication administration, so the reason why, as well as the patient has a right to refuse. I'm going to look at all of their allergies, making sure that the medication I'm going to give is not on that allergy list. I'm going to also check the expiration date on my medications as I pull them. So, first things first, I get my physician order and I say, yep, Colin Black, he has a history of COPD, as well as he's got a small bowel obstruction and he's been having pain. So I received the order from my instructor, so you'll receive your orders about 15 minutes prior to your checkoff time so that you have time to prepare yourself for the checkoff. So I received the orders that I'm going to give morphine, 2 milligrams IV push, as well as Solu-Medrol, 40 milligrams. So in that 15 minutes of your prep time, what you are going to do is you are going to use whatever resource that you have. There are drug books that are located in the lab. You have your Unbound Medicine resource available to you on whatever electronic device that you've installed it on. You are more than welcome to bring that in with you to the checkoff. So I am just going to show this to you real quick. Tell me if I'm too close, Marty. Is that good? So if you go to your Unbound Nursing Central app, if you click on your Davis Drug Guide, we'll go to all entries. I'm going to go ahead and jump to morphine because that's one of the medications that I am going to give. So there's my morphine. So you see it loads it. It's got all the other names of it. Tells me the type of drug that it is, indications, actions. It's also going to tell me times that it would be contraindicated. So in my assessment of this patient, since I'm going to give morphine, I am going to do blood pressure. I'm going to assess the respiratory rate. I'm going to assess my patient's level of consciousness because I know that this medication can drop the blood pressure. I know that it can depress the respiratory system. So if it's less than 12, I obviously don't want to give it up front. So it's got all the things that's contraindicated in, as well as, since I'm giving it IV push, I am going to keep scrolling down. It's got an area that says route/dosage, and so it tells you the typical doses that you will see given. But if I keep scrolling down, it will eventually tell me IV administration, and this is what's very important. I need to know how fast I am going to push this medication. So it says administer 2.5 to 15 milligrams over 5 minutes. Okay, so my dose is to give 2 milligrams. I'm just going to push it over, 1 to 2 minutes then. Okay, so that would be how you'd use your Unbound Medicine app to find out how fast you can push your IV medication. So during that 15 minutes of time, that's when you can look up your medications, mark a drug book, or write it down so that you know how fast you're going to push your medications. All right, I'm going to perform hand hygiene. I pulled my medications from the Pyxis. Right away, I note that the morphine that I pull is in a concentration of 4 milligrams per 1 ml. My dose from my doctor is 2 milligrams. So I do my med math, and I know that I'm only going to give half of an ml. So what I need to do is I need to waste the rest of that medication, especially since it is a narcotic. I'm going to be very careful with this, and I'm going to basically grab somebody else right away, another RN, to verify my waste. So before I even go into my patient room, I know that I need to waste this with somebody else. And when I say waste it with somebody else, they need to actually witness me waste it. So what I would do is I would find somebody else on the unit, another RN, ask them to come with me to the Pyxis. We pull the medication up and we document that I'm going to give 2 milligrams versus the 4 milligrams. And then it brings up another little box that then you put the amount that you're going to waste. So then, as we're doing that, what I'm going to do is, while that other RN is there with me, I am going to waste the medication in front of her. Okay, so I'll go over the sink, and I apologize, the sink is over there and it's not a true functioning sink. So we're going to pretend this is a sink, and with my other RN verifying, I'm going to go ahead and waste it to where I have half an ml, which is my 2 milligrams, which is the order I'm supposed to give to my patient. Okay, so if anybody ever comes up to you and says, hey, will you waste the medication with me? Your answer is, do you have the medication right now? Because if they're asking you to waste the medication and you are not actually witnessing that waste, don't do it. There's just horror stories and you don't want to be party to that.
Okay, keep going. It just paused.
Okay. Sorry. So you don't want to be party to that situation. There's a statistic out there, a recent one that said like 1 in 10 nurses in their lifetime will divert medications. I mean, so that is a very large number of people, and you just never know. So I've wasted my narcotic medication that I need to waste appropriately. All right, so now I'm ready to go into my patient's room. So I perform hand hygiene as I'm walking in. Knock. Hi, Colin. My name is Christine. I'm going to be your nurse today, okay? That's okay. How are you feeling? He expresses to me that he has some pain. I say, okay, let me just take a look at your wristband here. Can you just verify me your name and date of birth? And says Colin Block. Okay, perfect. He says his date of birth, and it matches. So, good. All right, sorry, I just need to do that safety-wise, making sure I have the right patient all the time and what we're going to do. He says, oh, yeah, they always do that. Yeah, I know. So, you are having some pain. Where is your pain at? In my belly. Okay. How bad is that pain in your abdomen on that scale of 0 to 10? 0 being no pain, 10 being the worst pain you can imagine. And he says it's like a 7. Okay, doctor has morphine ordered for you through your IV, so I can give you something to help with that pain. I also have another IV push medication that I'm going to give to you. It's called Solumedrol. That is a steroid. It's basically because you have that history of COPD, and I saw that you usually take prednisone at home. So we're going to give you Solumedrol while you're here, so that can go through your IV, and it's kind of the same type of thing as prednisone. It's going to help decrease the inflammation in your lungs, hopefully keep you breathing pretty good here. Have you ever had morphine before in the past? He says no. Okay, so morphine is a narcotic pain medication. It's a pretty good pain medication. Dr. Fett ordered 2 milligrams for you, so it's not a real high dose, but it's a good enough dose, especially for somebody that's naive to pain medication. We'll see how it works for you. Since I'm giving it IV, it's going to work pretty fast, pretty much within 15 minutes. I'm hoping that you'll feel some relief. Just the thing with it, I'm going to do an assessment before I give that medication because there's side effects just like with any drug. But I'm going to get your respiratory rate. I'm also going to get your blood pressure just to make sure it's safe to give it because it can lower your blood pressure. And just a few things like that, okay? And he says, oh yeah, sounds good. All right, so I do my appropriate assessment to what I'm going to give. Since I already know I'm going to give Solumedrol, I went ahead and I listened to his lung sounds as well. So for this first demonstration, let's say that I am going to give the morphine through a running line that is compatible. Okay, you've got saline running, and I'm going to give morphine. I check the compatibility in my drug book, and it is compatible. So what I'm going to do, I've got my MAR up. I take a look. Again, I verify my name, date of birth to my patient. I've already checked his armband. Looking at the allergies, he is not allergic to morphine. I'm going to go ahead and scroll down. I find the morphine on my list. And I'm going to say, okay, I've got morphine 2 milligrams. My orders for morphine 2 milligrams. Every 4 hours is needed for pain. I take a look at the last time he was given it. The new order, I look back, he hasn't been given any at all prior. So what I'm going to do is, I've already done my waste, so I know my dose is appropriate. I have my medication to show that I'm giving it. I'm going to go ahead and go over to my patient's IV site. The first thing that you always want to do when working with IV is check that site, make sure it's patent.
make sure there's no swelling, no redness, no kind of drainage around it or anything like that. Because we want to make sure that the medication we're going to give goes in the right place. So we want to make sure that he gets the effects from it. Because if it's not being given IV like it should be, and it's going into surrounding tissue, he's not going to get the pain relief that he's going to. And certain medications can do damage to the tissue as well. So we're saying that this IV fluid is compatible. So what I can do is I'm going to take the port that is closest to my IV site, and I'm going to go ahead and clean it off real good. All right. I've got my morphine. I've done my set of 3 checks. I checked my expiration date on my stuff before I was pulling it from the Pyxis, so I'm good to go. So I looked it up in my drug book in my 15 minutes of prep, and I know I can push it over 2 to 5 minutes. So what I did was I hooked it up there, twisted it on, I pushed back here, and I just gave a little push to that medication, okay? And then I'm going to release, and what's happening is this IV fluid is actually just going to carry it right in, okay? So I'm watching my clock on the wall, or you can have I do have a watch on my wrist, but I love that clock on the wall. It's just as nice and big and right there. So then, after a little bit of time, I'm going to give another little push, and then release again. I feel like we should be playing Jeopardy. But usually during this time is when you are working with a patient, you have good, meaningful conversation during these times. It's a little hard because he doesn't like to talk back to me, so it's hard to carry on a conversation, but that's when you can have some good conversation. So as well as I'm pushing this medication, Colin, are you having any pain or anything at the site, any stinging? He tells me no. I said, okay, that's great. If at any point, though, you feel any pain or stinging or swelling that you can tell is going on, please let me know, because that could be a sign that your IV site is bad, so I'd want to come and assess it right away, okay? He's like, okay. All right. Push a little bit more. Keeping an eye on my clock. We're going to say that we're at the 2 minutes. All right. So that is how you give a medication through an IV line when it's compatible. All right. So now let's say I'm going to be giving him Solu-Medrol, but now I've got something else in here, and I know it's not compatible because I've done my compatibility check in the computer or on a chart, wherever it's located in our facility. So what I'm going to do is I'm going to hit hold on my pump. Okay. If I didn't have a pump, what I could do is I could close my roller clamp. Okay. So if it's not compatible, depending on the facility that you work in, they may say 3 to 5 mLs of saline is needed to buffer your solution. So follow the policy of the facility that you are working in. But for my purpose, I'll just say I looked at my policy and they said I need to use 5 mLs of saline to buffer. And when I say buffer, what it's basically meaning is that I put my pump on hold. I'm going to pinch here just like I did before, but instead of pushing medication in and then releasing, pushing medication and releasing, I'm going to keep it pinched the whole time because I'm giving a saline buffer beforehand, a buffer between whatever solution is in this line and my medication, as well as after I give my medication, I'm going to give a buffer too, okay? So I have my saline to use as my buffer. Solu-Medrol, I'm verifying my order again. I verified the right patient. I've already double ID'd. I never left the room. I look at my order. I look at my allergies. It's not allergic. Look at my order, and my order is for 40 milligrams of Solu-Medrol to be given IV every 8 hours. It is the correct time for me to give. So I'm going to go ahead, take a look at my vial here. 20 milligrams per ml. My order is for 40 milligrams, so I know by doing my math, I need to give 2 ml. I think you clean it off, right? If ever you don't remember if you clean it off, what do? You clean it off again. All right, I got it cleaned off. I'm going to pull that tissue. Go ahead and put it in there, and that one in there is super easy because this has been used a few times, so I know I'm going to make a mess here. But typically that won't happen. I'm 15 minutes of prep time again. I checked my drug prep to see how fast I can give this. I can give this over like 3 to 5 minutes. Okay, so I've got my Solu-Medrol, I've got my buffer, and I need some alcohol. All right, so I've already put my pump on hold. Looking at my site again, just because I just gave medications and stuff like that. I'm going to clean off again the port that is closest to my patient. All right. All right, let me get rid of that little bit of air bubble in there. There we go. All right, so again, I'm going to push here, right above that port. Catch it. And my policy stated 5 ml. So I'm at 10, so I'm going to go ahead and push it to the 5. Feel okay, Colin? He says, yep, feels just fine. Good. Okay. I'm going to go ahead and recap it because I want to use that as my flush afterwards. Anytime that you leave that port, whether you touch it or not, really best practice is that you alcohol swab that port off again, okay? And here I'm watching the clock, and I'm going to push it over that 3 to 5 minutes like I looked it up for beforehand. So again, with this one, if it's compatible, I'm not going to release this line at all or anything like that. I'm keeping it pinched. And I'm just going to gradually push it, and again, having a conversation with my patient. So let's say you get orders for medications that maybe you need to push over 10 minutes. You're going to verbalize that to your instructor. What the instructor will probably do is have you push it at a slow rate, you know, over the few, how do I want to say this? They probably aren't going to sit there for the full 10 minutes while you push it. They are going to watch you push it at that slow rate, looking at it, being like, okay, yeah, they're going to get it in there at around the 10-minute mark. And they may say at like a 3 or 4 minute mark, being like, okay, for sake of time, we're going to say that you've pushed it in over the 10 minutes. So just so you're aware. Like I said, usually during this time you have some meaningful conversation with your patients, talk about stuff. You learn a lot about them. All right, so for sake of time for me, we're going to say it's been 3 to 5 minutes, and I've pushed my medication through, okay? Now, next what I'm going to do is I still need to do the back end buffer. Okay. Grab my alcohol swab again. Go ahead and clean off my port. Now what's very important with this back end buffer is that I push this at the very same rate that my medication was ordered to be pushed at. I shouldn't say ordered to be pushed at, he won't tell you the order, but what you looked it up and how it's supposed to be pushed at, that you push your flush, basically is what it is, at the very same rate. Because if you think about it, what you are doing is a bunch of your medication is going to be still all in this line. So if you don't push your back flush at this very same rate, and you just go ahead and push it in, what you're doing is you're giving that medication at a much faster rate than what you should be, and you could cause harm to your patient. So again, I'm going to be watching my clock and pushing this over that 3 to 5 minutes, okay? So, again, for sake of time, let's say I flushed, pushed it over that 3 to 5 minutes, open it up to make sure my patient is doing okay. I'm not done, right? Because I still have to put his fluids back onto what they were supposed to be running at. I tell my patient, okay, you've been given these medications. Like I said before, I'm going to come back in about 15 minutes, reassess your pain. Hopefully your pain will be better under control at that point. Okay, Colin? He says, yeah, that sounds great. Good. So then what I need to do is I need to clean up my mess, obviously. Any kind of sharps containers, you go into sharps. We've already done my waste appropriately. If you've got like a bigger vial, make sure that you check whatever the policy is at your facility, because certain medications, they go in certain containers. Like at the area, they've got a black container, a blue container, a red container, a yellow container. So depending on the medication that you give, you want to make sure you put it in the appropriate bin if you've got left in it so that it gets disposed of properly. And the rest I'm going to throw away. I'm going to make sure to perform hand hygiene afterwards, document the pain medication and the other medications that I have given, document my assessment beforehand as well as my follow-up in all of those items. All right, that is how to do it